Police are well equipped and well funded to deal with a variety of problems. However, when it comes to dealing with mental health disputes or nonviolent crimes, we may not be sending the city's best to deal with these particular problems. A community responder program can help save police and ambulances time by responding to low-level, nonviolent calls that police may not be the most equipped to handle. Colleen Kristich, senior researcher for the Partnership of the Public Good, explains why a program like this is needed.
They can be proactive. They don't have to only respond when a situation has escalated to a crisis. They can be called before anything harmful happens. So someone who's sleeping outside on a bench, or someone who might just be having a hard time and maybe is making some noise or shouting or something, community responders can be sent to that situation, talk to that person, and connect them to that care before it escalates to the point where 911 is called or police come.
Furthermore, when it comes to dealing with low-level disputes with people who have disabilities, the program becomes even more valuable.
So choosing to criminalize people who have psychiatric disabilities, for example, by sending police and treating them like they're committing a crime by having a psychiatric disability, is singling them out for punitive sort of response, and that's illegal. That's what the Americans with Disabilities Act is supposed to cover. So community responders is a way for municipalities, cities, counties to stop violating the ADA, because our current response of only sending police to those calls is running up against the federal government in how they're interpreting the ADA right now.
Community responder programs exist all over the country. The city of Durham in North Carolina and San Francisco in California are two of the many cities attempting to make their community responder programs the standard.
7th, we launched our crisis call diversion program. We put our first clinician in the call center. We had our first unarmed response team go out, our 3-person team, which is a clinician, peer, and EMT. And we started care navigation, though that wasn't fully staffed yet. Last week, we started our 4th and final pilot, co-response, which puts a clinician with an officer to respond to calls where there may be higher indicators of potential risk.
We wanted to try to get you to open table, see if you could get you some clothes.
New York State has given $100,000 for a community responder pilot program for Erie County. At this time, it is still unclear exactly when the program will begin. From WBFO News, I'm Jamal Harris Jr.